I'm Maria Hill. I'm an advanced specialist nurse in lung cancer. I've been using the voice recognition for a good few months now, and it has saved me so much time. So I do 3 clinics a week, often seeing between 5 and 10 patients. And in lung cancer, they're very complex, lengthy conversations, and when I type, I'm very much a single finger typer, and it was taking me a long time. I didn't have any secretarial support, but then when secretarial support was offered, the thought of sending my letters across, then having them sent back and to check them, to then sign them off, seemed again a lengthy process. So since I've had the voice recognition, I now use the function where you can insert a template very quickly by saying insert clinic consult note, and my entire headings of consultations, which then again helps me to not miss any important questions that I feel I need to ask a patient. That's very quick, and the fact that I can move through them just by pressing the button and then speaking into it and saying whatever's sort of being discussed in the consultation. I have very lengthy conversations with patients and their relatives, given the Breaking Bad News clinics that I do, and very complex situations. So to be able to just speak those consultations out to make sure that those are then well documented saves a massive amount of time, so that I have to sit and finger type lengthy conversations. So yeah, I found it very, very useful, saved me lots and lots of time, and I can now put my clinical letters on much quicker, and that means that I can then send them on to GPs and other healthcare professionals much quicker than waiting for them to be typed up or for me to have the time to type them. I also take maybe about between 10 and 15 phone calls a day, so to be able to quickly access the PPM system and just document through speaking what's being said and to record that is much quicker. It means that I'm not missing important documentation. I also use it for emails, and I'm very excited to be using it for university essay writing, speaking, no longer typing. So that's going to save me a massive amount of time. And again, I think when thinking about writing essays and you think about something, by the time you've typed it out, you've forgotten what you're going to say. So you could actually, it's really useful for just taking notes down about ideas. You can speak them, see them. So yeah, I found that really, really helpful. And I think all of my nurses have seen the time that it's saved, and are very, very keen themselves to have access to this service, and then that will then save them time to be doing more calls and more things that they want to do, rather than sitting, typing, which we all hate. So yeah, I find it very helpful.
Save my documentation because of its spoken words, and it's very accurate. And even in busy environments like our office, we've got 40 or 50 people in one place, it's loud, everything's going on, it's still very sensitive and it just picks up my voice. I spend far less time non-clinical now, so it means I get more patient-facing time. So it's really simple, you just press the button, put it somewhere near your mouth and you speak into it, and that's pretty much all you have to do.
I'm Arin, Saha. I'm one of the consultant general surgeons here at Calderdale, Huddersfield NHS Foundation Trust. It's been a revelation using voice recognition in my clinical practice here at Calderdale and Huddersfield. There are some real changes that have been brought to my daily working life, and my feeling is it's kind of really led to an increase in patient safety for me. In terms of efficiency, I tend to use the Nuance software in 2 ways. I have a physical handset that's connected to my laptop, and I use that for my admin, and I have the app on my phone and use that for my ward rounds. So to start with the ward rounds, there have been some real improvements. Previously, often I would find that the recording of my ward round by the juniors or the annotation in terms of my instructions wasn't necessarily clear. By using the Nuance software and the drag dictation app on my phone, I'm able to dictate really clearly, and that goes into the computer record immediately. It's led to increased accuracy, the notes in there right at the beginning, but more importantly, what I want to say what I want to record, what I think is important for the patient's electronic patient record, is done and recorded exactly as I want it. It's been great, and it's certainly made things quicker. For the juniors as well, it means that they're able to focus on the ward round. They're able to focus on my instructions, they're able to focus on the jobs that they need to do. And rather than using them for purely administrative tools, they're able to have the ward round as a much greater learning experience as opposed to just simply recording things. I've really found that side of things brilliant actually. With the physical handset, I tend to keep that plugged into my laptop, and I did have some worries at the time because previously letters were dictated on a different type of dictation software, and our secretaries or typists would type those up. And I always really like my letters going to my secretary. My secretary's excellent, she's really on top of my clinical practice, and I always felt that using voice recognition would take away some of that connection, but actually it's done quite the opposite. I'm able to take letters straight away, which means that I'm able to look at them and correct them immediately, and that's really saved me a huge amount of time for admin. I'm not having to look at letters at some point down the line. I'm able to put letters directly into my secretary's inbox, whereas before I wasn't sure that my secretary would type the letter. Now I know that the letter and any instructions go straight to her, and that's really meant that when a patient phones, if they've got any questions, my secretary knows immediately what the plan is and what things are outstanding. The other thing that I found really beneficial is in clinic, because I'm able to take the letter immediately in clinic and print out a copy for the patient, so that whereas often the patient will go and will kind of remember what they want from you, they'll kind of remember what they told you, they've forgotten by the door, and they've certainly forgotten by the time they reach the car park. Now I'm able to print out the letter there and then, highlight the bits that are important, and they leave the clinic with a physical record of what we talked about and what I'm planning next. It's led to a significant reduction in time for me. It means that my secretary and me can look at the clinic in real time and work out what's been requested and what hasn't. All of those things combined mean that the voice recognition software, which I found to be accurate, very, very efficient and very, very easy to use, has made my clinical practice a lot more efficient and a lot easier for me. Finally, I think it's important to say that the support that we get here at the Trust is excellent. Anytime I've had a problem with the software, which has been pretty limited actually, or the hardware, I'm able to contact Caroline and the rest of the team, and they've been able to fix it for me almost immediately. That connection and that kind of support that you get between me and my secretary and us as a clinical team together has been invaluable. I honestly can't see a way I'd ever go back now. It's led to such improvements in my quality of life and the recording of my clinical interactions that I'm really pleased with it, and I think it's a real positive for the Trust.
Hi, I'm Jane. I work for Mr. Saha. I'm his secretary. I don't directly use voice recognition, but I do help Mr. Saha, and I've helped him set it all up. My daily work really, it's not affected it too much, other than that I'm not doing any typing for him anymore. But when I do want him to do any letters, they come straight through to my box and I can action them. He does all his clinics through voice recognition, which is easy as well for me to pick up as anything he wants me to do. He leaves a note on the end of it, whether it's a copy to a GP, including leaflets, copies to other consultants, anything like that. It just makes it really easy for me to pick it up and do it rather than waiting maybe a week, a couple of days before the letter was typed. It's done immediately. It's also freed up my time so that I can do other parts of my work, including looking after the waiting list. I'm also the bariatric coordinator, so it's freed up more of my time to enable me to do that side of the work as well. But other than that, it has really made my job easier. I wouldn't be worried about you're losing out on anything. Because like I say, it is one of the best things that we've done. It does make my job a little bit easier.